Welcome to the DNP Conversation, a recorded interview series featuring nursing practice professionals from across the country. Our purpose is to share the amazing work of doctorally prepared nurses and how they're making an impact on patient, organizational, and academic outcomes. I'm Dr. Jeannie Corey from James Madison University.
And I am Dr. Brenda Douglas from Drexel University. We are delighted that you could join us today. Today we have the pleasure of speaking with Dr. Shannon Idzik. She's an associate professor, organizational systems and adult health, and an associate dean for the DNP program at University of Maryland School of Nursing. Dr. Idzik obtained her bachelor's from York College of Pennsylvania, her master's in adult nurse practitioner, DNP, and certificate of teaching in nursing and health professions from the University of Maryland in Baltimore. Dr. Idzik's scholarship is focused on the DNP, nurse practitioner education, practice, and policy, along with endocrinology. We're so happy to have you here today.
Thank you.
You're welcome. Knowledge and skills regarding quality improvement are critical as nurses impact organizational and practice and patient outcomes. Talk with us about quality improvement as an essential skill and ethical responsibility of DNP prepared nurses.
Thank you, Brenda. You know, this has always been an interesting point for me, mainly because I think it is a differentiator between the ethical piece of it, at least, between quality improvement and research, and then in that, the DNP and the PhD. I think quality improvement is really our highest calling in nursing, to really improve the quality of care that we deliver to both individual patients and the community. And for this reason, I think there can't be any exclusions on quality improvement. And I face this a lot as I've worked over the past, 10 to 15 years with the DNP. And I often will hear from faculty colleagues, oh gosh, we can't do that project there because of, worried about vulnerable populations or marginalized populations. And I will often say to them, listen, it is our ethical responsibility to improve care across the globe in all populations. So, for example, people might say, gosh, it'll be hard for us to do this project on pregnant women or on this prison population or et cetera. And I say that's exactly why we have to do it, because it is really our highest calling as nurses to improve care, and particularly in the difficult groups.
Thank you. What you shared that, how important quality improvement is for nurses and how it's evident in the new essentials. So there's a lot of energy and excitement around the new essentials. So would you share how the new essentials will influence DNP education and practice?
Jeannie, I am really excited about the new essentials. When I read them, when I first saw them and I thought, gosh, they're all in one now, I was a little surprised. But as I spent time, I feel like steeping in them over the past 6 months, I have a newfound appreciation for the goal of really, kind of leveling out what we do in nursing, making it more simple so that external stakeholders know what we're trying to deliver. And there are some key pieces to the essentials that I think really have me excited. I think one, as for those of you who know me, I've always been really excited about health policy and impacting practice change through policy. And one of the areas that kind of took me aback, as I mentioned earlier, was that health policy was no longer listed as a domain, as an essential, like it was in the DNP essentials. And at first I was like, oh, how can we take that out? That's so critical. And then as I really got into it, I noticed that health policy is now really, it is a concept. And it's threaded throughout all of the domains. And it's a really heavily focused on level 2. So that was really exciting to me. I think as doctorally prepared nurses, that's probably one of the differentiators. I think health policy is critical in the level 1 competencies at the baccalaureate master's level. But I think as we get into the doctoral level, it is really incumbent upon us to try to change healthcare and try to improve practice through policy change. The other thing I was really excited about is the focus on engaging in professional organizations. That's always been kind of one of those things that's I've pushed for students, as an educator, is the importance of engaging in professional organizations. I think, there are so many of us in the nursing profession. There are more of us than there are of all the other professions put together. And that should speak volumes, yet our voice is not nearly as loud as it should. And sometimes our voice is more easily heard in professional organizations. Now, don't get me wrong, that doesn't mean we shouldn't be talking individually to legislators and working on policies as individuals, but our role in professional organizations and supporting professional organization work will really help us change larger level policy. Politicians will often listen to these major nursing organizations, maybe above an individual constituent. So I was really excited about that part. But I do think that the essentials, the new essentials are going to help us, re-envision nursing. They don't really change nursing, but it helps us really set the stage in a different way.
Oh, thank you, Dr. Idzik, for sharing your excitement about the new essentials, particularly highlighting about health policy and engagement in professional organizations. They are two crucial pieces. In addition to the foundational elements on which the essentials were developed, diversity, equity, and inclusion served as design influencers. We would love to hear more about your experience concerning diversity, equity, and inclusion in the DNP program at the University of Maryland.
This is a really opportune time for me to talk about this, because last week at the school, we launched a DEI effort, and it was titled In Unison. So SON was for School of Nursing. In Unison, together we commit, together we act. And it was a really powerful time for the school. A group of faculty, I was involved in it, but there was many people, faculty, staff, students, administrators, really all working together on our commitment statement. And as a school, we acknowledge the impact of structural racism and our other forms of oppression on our country and our communities and in our school in particular. We spent some time recognizing the ways that our institution was not, and really still is not, a welcoming and supportive place for all of the constituents. Our community in Baltimore has too often been the victim of oppression and incivility and racism and discrimination. And we have a lot of work to do. So as a school, we recited together a list of commitments, and many of them were focused on, listening, speaking up, spending time in other people's space. So it was a really exciting time. And we've worked, for many years through a variety of ways. I mean, this is, it's obviously not a one-day event. It is a continuous, it's like the marathon, it's a work in progress. We've worked in a variety of ways to increase diversity concepts in our curriculum, in our programs, in our student body, and in our workplace. But I am very proud of our school, and particularly I'm very proud of our program. Our school has a 48% minority student body, which to me is amazing. It's excellent. We have a lot of work to do because there were many years where we didn't have that. And so we have some makeup work to do, so to speak. And I'm also really excited about our DNP program. The new essentials do a great job of bringing this all to light, as do the new Future of Nursing 2020 to 2030, and its focus on social determinants of health. But there's a real integration of DEI in the new essentials, and it moves it away from an isolated focus on one essential, but is considered a really critical concept. The concepts are really then defined within the competencies, and they're integrated through all of the domains. So it's a real focus on diversity, equity, and inclusion. And as nurses, we have a lot of ongoing professional development to do, understanding our own conscious and unconscious bias. We know as educators that diverse and inclusive environments are really necessary for us to achieve excellence in teaching, learning, research, scholarship, service, and in particular practice.
Thank you so much, Dr. Idzik. You have some amazing work happening at your university, and we appreciate you sharing that with our audience. And thank you for sharing your insight and perspectives on many critical topics, and for joining our conversation today. We also want to thank our listeners. As we all know, nurses across the country are making a significant contributions to the health of our communities and to the leadership of healthcare organizations and to our academic institutions. And as we also know now more than ever, it's imperative that we continue to dialogue about what we do, how we do it, and the successes that we experience. It's our hope that these conversations fuel and inspire you in some way, and let's keep the conversation going. Until next time, I'm Dr. Jeannie Corey, along with Dr. Brenda Douglas, and we thank you so much for listening. Have a great day.
Until next time, thanks for joining us.
Thank you.